Welcome to the 2012 National Kidney Foundation meetings. On behalf of eAJKD, the official blog of the American Journal of Kidney Diseases, I'm Tejas Desai, and I'm happy to be joined by Dr. Javier Neyra from Henry Ford Hospital. Welcome.
Thank you very much, Dr. Desai.
So Dr. Neyra, you've done an interesting study in predicting acute kidney injury in septic patients. Why don't you tell us a little bit about that?
Sure. So we basically did a study where we check severe critical ill patients admitted to the ICU. We check around 500 patients, and we try to analyze the prediction of the dipstick test, specifically for the change in proteinuria, to see if this can predict the development of AKI in this very susceptible population, because we know these patients with severe sepsis have at least a 30% chance to develop AKI during the admission to the hospital. So we found really that there was an interesting correlation between the positivity of the dipstick with the development of acute kidney injury, that we use the Akin definition, and we also analyze any change in serum creatinine more than 0.3 milligrams per deciliter. So we adjust, of course, these findings to all the variables that we know could affect acute kidney injury, the development of acute kidney injury in these patients, such as heart failure, diabetes, hypertension, use of vasopressors. And we found that dipstick proteinuria in our study was an independent predictor of acute kidney injury in these patients. In this specific population, we tried to have a documented negative dipstick before this admission. So we have, within 3 months prior to the admission, negative dipstick, and we also have these patients all have creatinine less than 1.5. So patients with no CKD, documented negative dipstick, admitted with severe sepsis, and the positivity of the dipstick seems to be an independent predictor for acute kidney injury, and those results were very interesting, with some solid base in animal studies.
I see. Mm-hmm. Now, where do you and your research team go next with this prediction model?
So basically, the combination of the prediction of this dipstick test that is has more specificity, we think, than the conventional, or the new biomarkers of acute kidney injury that are very sensitive. So combining this, for example, the urine NGAL plus the information that you can get from a routine urinalysis, the urine dipstick, and recently with this validation of the scores for urine microscopy too. So we may end having sensitivity through these early biomarkers, and with our routine urinalysis and urine microscopy, we will have also good specificity. So the good predictions tools for very susceptible populations. So our next step is basically to check if the grades of acute kidney injury, see if dipstick really can predict severe cases that they can require dialysis, or they can become a stage 2 AKI. So if we can have a more a specific utility for this prediction, if we can really target not only susceptible population to AKI, also susceptible population to severe AKI, and that would be also very interesting to check, specifically with the dipstick and other biomarkers.
Well, thank you very much. This is very interesting work.
Thank you.
Thank you very much for joining us at the 2012 National Kidney Foundation meetings.